Keeping children safe makes sense to all of us. Yet, each year, millions of children are affected by unintentional injuries, which can result in disability, hospitalization, and even death. I'm Ileana Arias, Director of the Centers for Disease Control and Prevention's Injury Center. We know that in the United States, unintentional injuries, or accidents, are the leading cause of death among young Americans between the ages of 1 and 18. Overall, motor vehicles and traffic-related injuries are the leading cause of fatal unintentional injuries among children, followed by drowning and residential fires. Unintentional injuries continue to be the leading cause of non-fatal child injuries treated in hospital emergency departments across our nation. The World Report on Child Injury Prevention is a life-saving document. It shows that there is strong and growing scientific evidence for the benefits of child injury prevention and control. Injuries do not have to be an accepted risk. Lives can be saved and injuries can be prevented. But in order to save lives, we need a strong coalition of governments, communities, and individuals around the world who will dedicate themselves to supporting the adoption and maintenance of injury prevention interventions. CDC is committed to both promoting the widespread adoption and use of effective interventions and to expanding the current research to prevent childhood injuries. Joining together with WHO and UNICEF in their joint launch of the World Report on Child Injury Prevention, we have identified the risks that place our children in harm's way around the world. Now, we must and will act locally to renew our child injury prevention efforts. We're excited to launch a new initiative in the United States, Protect the Ones You Love. We know that there are steps that everyone can take to reduce the enormous burden of child injury. Through the Protect the Ones You Love initiative, CDC will work with federal, state, and local governments, as well as non-governmental organizations, to reach out to parents across the country. Our combined efforts will help to raise parents' awareness about the leading causes of child injury and to empower them to keep their children injury-free. With the World Report, WHO and UNICEF began the international dialogue about childhood unintentional injuries. They have provided the research and data needed to examine this public health issue. Our challenge is to keep this momentum as we continue to work with our injury prevention colleagues, both in the United States and around the world. We share an overriding common goal: keep all children safe and secure and help them live to their fullest potential.